Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. In this video, we're learning about Polycystic Ovary Syndrome. So go ahead, subscribe, and let's get started. Polycystic Ovary Syndrome, or PCOS, is a common hormonal condition that affects many women during their reproductive years. In this condition, the body produces hormones in an imbalanced way. Because of this hormonal imbalance, the ovaries may not release eggs regularly, which leads to irregular ovulation and irregular menstrual cycles. In women with PCOS, the ovaries may contain many small fluid-filled sacs called cysts. These are actually immature follicles that did not develop properly. Another important feature of PCOS is an increase in male hormones called androgens. Higher levels of these hormones can cause symptoms such as irregular periods, acne, or excess hair growth. Because ovulation may not occur regularly, PCOS is also considered one of the common causes of infertility in women. However, with proper lifestyle changes, medical treatment, and regular follow-up, many women with PCOS can manage the condition effectively and lead a healthy life. Now, let us see the causes of Polycystic Ovary Syndrome, also known as PCOS. The exact cause of PCOS is not clearly known, but several factors are believed to contribute to the development of this condition. One important factor is genetic predisposition. This means that PCOS can sometimes run in families. If a woman's mother or sister has PCOS, there may be a higher chance that she could also develop the condition. Another major factor is insulin resistance. In this situation, the body's cells do not respond properly to insulin. As a result, the body produces more insulin, which can affect the ovaries and increase the production of male hormones. Hormonal imbalance is also a key cause. When hormones in the body are not balanced properly, it can interfere with the normal process of ovulation. Excess production of androgens, which are male hormones, is another important factor. Higher levels of these hormones can prevent the ovaries from releasing eggs regularly and may lead to symptoms such as irregular periods, acne, and increased hair growth. Lifestyle factors can also play a role. Conditions such as obesity and a sedentary lifestyle can worsen insulin resistance and hormonal imbalance, which may increase the risk of developing PCOS. Now let us see the risk factors of Polycystic Ovary Syndrome. Risk factors are conditions or situations that increase the chance of developing PCOS. One important risk factor is family history. If someone in the family, such as a mother or sister, has PCOS, there is a higher possibility that other female members may also develop the condition. Obesity is another major risk factor. Excess body weight can increase insulin resistance and disturb the hormonal balance in the body, which may contribute to the development of PCOS. A sedentary lifestyle also increases the risk. When a person has very little physical activity and spends most of the time sitting, it can lead to weight gain and metabolic problems that may worsen hormonal imbalance. Type 2 diabetes is also linked with PCOS. Women who have insulin resistance or diabetes may have a higher risk of developing this condition because insulin plays an important role in hormone regulation. Early puberty is another possible risk factor. When puberty starts at a very early age, hormonal changes in the body may increase the likelihood of developing PCOS later in life. Now let us see the pathophysiology of Polycystic Ovary Syndrome. Pathophysiology explains how the disease develops inside the body. It usually begins with insulin resistance. In this condition, the body's cells do not respond properly to insulin. Because of this, the body produces more insulin, which leads to increased insulin levels in the blood. The high level of insulin then stimulates the ovaries to produce more male hormones called androgens. When the level of these androgens increases, it disturbs the normal hormonal balance in the body. Due to this hormonal imbalance, the normal development of ovarian follicles is affected. The follicles are small sacs in the ovary that contain developing eggs. Because the follicles do not mature properly, ovulation may not occur. When ovulation fails, the immature follicles remain in the ovaries and start to accumulate. Over time, these accumulated follicles appear as many small cysts in the ovaries. This is why the condition is called Polycystic Ovary Syndrome. Now, let us see the clinical manifestations of polycystic ovary syndrome, starting with the menstrual symptoms. One common symptom is oligomenorrhea. This means the menstrual periods occur less frequently than normal. Instead of having regular monthly cycles, the periods may come after a long gap. Another symptom is amenorrhea. In this condition, menstruation may stop completely for several months. This happens because ovulation does not occur regularly. Women with PCOS may also experience irregular menstrual cycles. The timing of the periods may vary each month, making the cycle unpredictable. Some women may also have heavy menstrual bleeding when periods occur. Because the menstrual cycle is irregular, the lining of the uterus may build up for a longer time, which can result in heavier bleeding during menstruation. Now let us continue with the other clinical manifestations of polycystic ovary syndrome. First, we will look at hyperandrogenism symptoms. These symptoms occur because the body produces higher levels of male hormones called androgens. One common symptom is hirsutism, which means excessive hair growth on the face, chest, or other parts of the body. Another symptom is acne, which may appear more frequently due to hormonal imbalance. Some women may also experience alopecia, which means thinning of hair on the scalp. Next are the reproductive symptoms. One important problem associated with PCOS is infertility. This occurs because ovulation may not happen regularly. Another related condition is anovulation, which means that the ovary does not release an egg during the menstrual cycle. Finally, there are metabolic symptoms. Many women with PCOS may experience weight gain, especially around the abdomen. Insulin resistance is also common, where the body does not respond effectively to insulin. Another sign that may appear is acanthosis nigricans, which is characterized by dark, thickened patches of skin, usually seen on the neck, underarms, or other body folds. Next, let us see the diagnostic criteria of polycystic ovary syndrome. PCOS is commonly diagnosed using something called the Rotterdam criteria. According to this guideline, a woman is diagnosed with PCOS if at least 2 out of 3 main features are present. The first feature is irregular ovulation. This means the ovaries do not release eggs regularly, which often leads to irregular or absent menstrual periods. The second feature is hyperandrogenism. This refers to increased levels of male hormones in the body. It may be identified through symptoms such as excessive facial or body hair, acne, or hair thinning, or it may be confirmed through blood tests. The third feature is the presence of polycystic ovaries on ultrasound. During an ultrasound scan, the ovaries may appear enlarged and contain many small follicles that look like cysts. If any 2 of these 3 features are present, along with proper clinical evaluation, a diagnosis of polycystic ovary syndrome can be made. Now let us look at the other investigations that help in the diagnosis and assessment of polycystic ovary syndrome. One important investigation is pelvic ultrasound. This test helps doctors to visualize the ovaries and check for the presence of multiple small follicles or cysts. It can also show if the ovaries are enlarged. Another test is the serum testosterone test. This blood test measures the level of testosterone in the body. In many women with PCOS, the level of this hormone may be higher than normal. The LH and FSH ratio is also evaluated through blood tests. These hormones regulate the menstrual cycle and ovulation. In PCOS, the level of luteinizing hormone may be higher compared to follicle-stimulating hormone. Blood glucose testing is done to check the sugar level in the blood. This is important because many women with PCOS may develop insulin resistance or have an increased risk of diabetes. A lipid profile test is also performed to evaluate cholesterol and fat levels in the blood. Women with PCOS may have abnormal lipid levels, which can increase the risk of cardiovascular problems. Now, let us see the medical management of polycystic ovary syndrome. The treatment of PCOS mainly depends on the symptoms a woman experiences and whether she is planning for pregnancy. Different medications are used to control hormonal imbalance, regulate menstrual cycles, and manage other symptoms. One common treatment is oral contraceptive pills. These pills help to regulate the menstrual cycle and maintain hormonal balance in the body. They can also help reduce symptoms like acne and excessive hair growth. Another medication often used is metformin. This drug helps to improve insulin resistance, which is a common problem in women with PCOS. By improving the body's response to insulin, it can also help regulate menstrual cycles. Clomiphene citrate is another medication that may be prescribed, especially for women who are trying to conceive. This drug helps stimulate the ovaries and induce ovulation. Anti-androgen medications such as spironolactone may also be used. These medicines help reduce the effects of excess male hormones and can decrease symptoms like excessive facial or body hair. If infertility is present, doctors may recommend additional fertility treatments to help achieve pregnancy. Now, let us see the lifestyle management of polycystic ovary syndrome. Lifestyle modification plays a very important role in managing PCOS. One of the most important steps is weight reduction. Maintaining a healthy body weight can help improve hormonal balance and reduce many symptoms associated with PCOS. Regular exercise is also very important. Physical activity helps improve insulin sensitivity, control body weight, and support overall health. Following a healthy and balanced diet is another key aspect. A diet that includes fruits, vegetables, whole grains, and adequate protein can help maintain stable blood sugar levels and improve metabolic health. Stress management is also important for women with PCOS. Stress can affect hormonal balance, so practices such as relaxation techniques, yoga, or meditation may help in managing stress. Even a small amount of weight loss can make a significant difference. Losing about 5 to 10% of body weight can help improve menstrual regularity, reduce symptoms, and support better overall health. Now, let us see the lifestyle management of polycystic ovary syndrome. Lifestyle modification plays a very important role in managing PCOS. One of the most important steps is weight reduction. Maintaining a healthy body weight can help improve hormonal balance and reduce many symptoms associated with PCOS. Regular exercise is also very important. Physical activity helps improve insulin sensitivity, control body weight, and support overall health. Following a healthy and balanced diet is another key aspect. A diet that includes fruits, vegetables, whole grains, and adequate protein can help maintain stable blood sugar levels and improve metabolic health. Stress management is also important for women with PCOS. Stress can affect hormonal balance, so practices such as relaxation techniques, yoga, or meditation may help in managing stress. Even a small amount of weight loss can make a significant difference. Losing about 5 to 10% of body weight can help improve menstrual regularity, reduce symptoms, and support better overall health. Now, let us see the nursing management of polycystic ovary syndrome, starting with assessment. The first step in nursing management is to assess the menstrual history of the patient. The nurse should ask about the regularity of the menstrual cycle, the duration of periods, and any history of missed or irregular menstruation. Next, the nurse should assess the patient's weight and body mass index, also known as BMI. Monitoring weight is important because many women with PCOS may experience weight gain or obesity, which can worsen the condition. The nurse should also observe for signs of hyperandrogenism. These may include symptoms such as excessive facial or body hair, acne, or thinning of hair on the scalp. Finally, the emotional status of the patient should be assessed. Women with PCOS may experience emotional stress, anxiety, or depression due to hormonal changes and concerns related to body image or fertility. Proper emotional assessment helps the nurse provide appropriate psychological support. Now let us see the nursing interventions for women with polycystic ovary syndrome. One important intervention is monitoring the menstrual pattern. Nurses should encourage patients to keep track of their menstrual cycles, including the frequency and duration of periods. This helps in identifying irregularities and evaluating the effectiveness of treatment. Another important role of the nurse is to educate the patient about lifestyle modification. Patients should be informed about the importance of maintaining a healthy lifestyle to manage the symptoms of PCOS. The nurse should also encourage weight control and regular exercise. Maintaining a healthy body weight and engaging in physical activity can help improve hormonal balance and reduce insulin resistance. Supporting adherence to medications is another key responsibility. Nurses should explain the purpose of prescribed medications and encourage patients to take them regularly as advised by the healthcare provider. Providing psychological support is also very important. Women with PCOS may experience emotional stress, anxiety, or concerns related to fertility and body image, so emotional support and counseling can be helpful. Finally, nurses should educate patients regarding fertility options. If the patient is planning for pregnancy, information about available fertility treatments and medical guidance can help them make informed decisions. Now let us see the health education for women with polycystic ovary syndrome. An important point in health education is the importance of regular follow-up. Women with PCOS should attend regular medical checkups so that their symptoms, hormone levels, and overall health can be monitored. Regular follow-up helps doctors detect any changes early and manage the condition effectively. Another important aspect is maintaining a balanced diet and regular physical activity. Eating nutritious food, such as fruits, vegetables, whole grains, and proteins, can help control body weight and maintain hormonal balance. Regular exercise also helps improve insulin sensitivity and overall health. Early treatment is also very important. When PCOS is diagnosed and managed early, it helps reduce the risk of long-term complications such as diabetes, heart disease, and other metabolic problems. Proper treatment and lifestyle changes can greatly improve the quality of life for women with PCOS. Finally, let us see the prevention of polycystic ovary syndrome. There is no absolute way to completely prevent PCOS, but the risk can be reduced by maintaining a healthy lifestyle. One important step is maintaining a healthy body weight. Keeping body weight within a normal range helps maintain hormonal balance and reduces insulin resistance. Regular exercise is also very helpful. Physical activity improves metabolism, helps control body weight, and supports overall hormonal health. Following a balanced and nutritious diet is another important preventive measure. Eating healthy foods such as fruits, vegetables, whole grains, and lean proteins can help maintain stable blood sugar levels and support overall health. Early diagnosis is also very important. Identifying symptoms early and seeking medical advice can help manage the condition effectively and prevent long-term complications. Now, we come to the end of this presentation on polycystic ovary syndrome. Thank you for watching and taking the time to learn about this important health condition. I hope this presentation helped you understand the causes, symptoms, diagnosis, management, and prevention of PCOS in a simple and clear way.